Welcome back to the deep dive. We got a lot of interest in common health stuff for pets.
That's right.
So today we're tackling those, lumps and bumps, specifically canine and feline hair follicle tumors.
Yep. We've waded through some of the, let's say, denser medical information.
Pull out what you really need to know,
Yeah.
right? Without getting lost in jargon.
Exactly. Consider this your quick guide.
Okay, so hair follicle tumors. What are the main players here?
Fundamentally, we're looking at two main types. There's trichoepithelioma, sometimes called trichoblastoma.
Okay,
That one comes from the outer part of the hair follicle, the sheath.
got it. Outer sheath. And the other?
That's pilomatrixoma. It originates deeper from the hair matrix, the part that actually makes the hair.
Matrix. Okay. So, big picture, how worried should we be if we find one of these? Are they bad news?
Generally speaking, no. The good news is that most of these are benign,
Benign. Okay, that's a relief.
meaning not cancerous. Now, there's a small caveat. Very rare cases of pilomatricomas in dogs have been reported as malignant.
Oh, okay. Important to know for dog owners then.
Definitely. And just for context, these types make up maybe 5% of all skin tumors in dogs. Pretty uncommon in cats, though.
5%. So not super rare in dogs, but not everywhere either. What about who gets them? Puppies? Older dogs?
It tends to skew towards older animals, usually pets over 5 years old.
Makes sense. Like many things.
Yeah. And interestingly, there doesn't seem to be a male or female predisposition. It's pretty equal.
No gender bias. But what about breeds? You often hear about certain breeds being prone to specific things.
Yes. That's where we do see some patterns. It gets quite specific.
Okay, let's hear it. Which breeds should be on the lookout?
All right, so for trichoepitheliomas, remember, common in dogs, rare in cats.
Right.
We often see them in breeds like golden retrievers, basset hounds, German shepherds, cocker spaniels, Irish setters,
Wow, quite a list.
English springer spaniels, miniature schnauzers, standard poodles, too. The
Hmm.
cats, maybe Persians and Siamese, but again, it's rarer.
Okay. And the other type, Pilomatrixoma.
Pilomatricomas are less common overall in both species. But in dogs, you might see them slightly more in, say, Kerry Blue Terriers and miniature poodles.
Kerry Blues and mini poodles. Got it.
For cats, there isn't really a known breed connection for Pilomatricomas.
Okay, so if you have one of those dog breeds, maybe pay a little extra attention during petting time. What exactly are you looking for?
Usually it's a single mass you'd notice. Its location can be a clue, too.
How so?
Well, trichoepitheliomas in dogs often show up on the sides of the chest or the lower back area. In cats, more often the head.
Chest, back for dogs, head for cats. Okay.
Pilomatricomas tend to favor the back, shoulders, flanks like the side's tail, and limbs. Could be anywhere in that zone, really.
And what do they feel like? Or look like?
Typically, they feel quite firm,
Mm.
often round or sort of dome-shaped, and raised from the skin, usually well-defined edges.
Okay.
You might also notice the skin over them is hairless, or maybe even a bit ulcerated or sore-looking. And just out of interest, if a vet were to, look at a sample, trichoepitheliomas often have this grayish appearance inside. Pilomatricomas can look more lobulated, maybe with white chalky spots.
Interesting detail. What actually causes these things to start growing? Do we know?
That's still a bit of a puzzle, honestly. The exact trigger isn't known. But given those predispositions we just talked about,
Right.
a genetic link is strongly suspected. Something in their makeup makes them more susceptible.
Okay, that makes sense. So you find a lump, you take your pet in. How does the vet figure out which type it is, or if it's something else entirely?
Yeah, differentiating is key. It could be other things like a basal cell tumor, maybe squamous cell carcinoma, or even just a cyst.
There's lots of possibilities.
Exactly. So
Mhm.
the diagnostic process usually involves, first, maybe a fine needle aspiration.
Sticking a small needle in to get some cells.
Precisely. They collect a few cells, put them on a slide, and look under the microscope. That's called cytopathology. Or, for a more detailed picture, they might do a tissue biopsy. Take a small piece of the actual lump.
For histopathology, right.
You got it. Histopathology. And looking at the specific cell types helps clinch the diagnosis. Pilomatricomas have characteristic things called basiloid cells and ghost cells.
Ghost cells. Spooky.
Yeah. And trichoepitheliomas show cells trying to form tiny hair follicle structures, often with these things called horn cysts.
So different microscopic clues for each.
Exactly. Helps tell them apart.
And once you know what it is, what's the treatment plan?
For the vast majority of these, the answer is pretty straightforward. Complete surgical removal.
Just cut it out.
Yep. Excising the whole tumor is usually curative, especially since most are benign. Get it all out, problem solved.
Is medication ever used?
Well, surgery is the main thing. But there was one interesting report where a drug called isotretinoin,
Isn't that used for acne sometimes?
the same family, yeah, it showed some success in controlling multiple pilomatricomas in one dog. So maybe an option in specific rare cases. And, of course, if a lesion is painful for some reason, pain management medication is definitely recommended.
Naturally. So, prognosis. What's the outlook after treatment?
Generally, it's excellent. If the surgery gets clear margins, meaning they remove the whole tumor, the outlook is very positive.
Good news.
Definitely. The main thing is just to monitor the site, keep an eye out for any local recurrence, although that's not super common if the removal was complete.
And just remembering those rare malignant pilomatricomas in dogs.
Exactly. That's why follow-up and vigilance are always smart, especially with dogs. Those rare ones can potentially metastasize or spread.
Right. So wrapping up this deep dive then, hair follicle tumors, more common in dogs than cats, mostly benign, surgery's the usual fix. Key takeaway.
I'd say awareness is key. Knowing about the breed links, knowing what these lumps typically look and feel like, and where they tend to pop up.
Helps you spot them early during those routine checks or cuddle sessions.
Absolutely. Early detection makes treatment simpler and more effective.
And it leaves you thinking, doesn't it, about that genetic piece?
It really does. What could future research tell us? If we could identify specific genetic markers in those predisposed breeds.
Could we potentially screen for risk? Or maybe even develop preventative strategies down the line?
It's food for thought, for sure. It definitely underscores the value of, well, knowing your pet, regular vet checkups, and just being observant about any changes.
Couldn't agree more. Good advice for any pet owner. Thanks for breaking that down for us.
My pleasure.